Dom time in a busy week with all that's gone on with the Patriots, this local story in Bridgeton. Mike Huckabee, I have a lot of sound from Huckabee last night in media. A story caught my attention because of something I did around getting my master's, and I'm glad to see these guys that have the cachet, the credibility, the name, the standing to put this out. It's a study this week that said, look, a group of bioethicists at the University of Pennsylvania have taken a bold stand in a paper published in the Journal of the American Medical Association. They say the United States should bring back mental asylums. Joining us to talk about that, which seems to be wow, is Michael Brody. Dr. Brody is president and CEO of Mental Health Association. He joins us here on Talk Radio 1210. Hey, Dr. Brody, thanks very much for joining us.
Thanks, Dom. And before you give me too many credentials, not doctor, just plain old Michael.
Okay, fine, Michael. Thanks very much. What the hell are you guys thinking about? I have to ask you, even though I think I support, by the way, I'm not a fan, but a co-author is Ezekiel Emanuel, which we'll get to in a moment.
Right.
But I think you say there are a whopping 10 million Americans today with serious mental illness. What would that mean? Schizophrenia, things like that?
Sure. I mean, people who have been diagnosed with schizophrenia, bipolar disorder, which is euphemistically known as manic depression, major depression, people with dual diagnosis with some co-occurring substance use are typically the people who are considered to be seriously mentally ill.
And Michael Brody, the theory is that I remember doing my master's around this. It was deinstitutionalization. I went to Antioch where I got my master's, and that was one of the big things they talked about. We had seen Geraldo and others at that point in time, you may remember, exposing the warehousing. Byberry was a place. Pennhurst, I think, was a nightmare. So how could you guys say we ought to go back to a system of state hospitals, asylums?
Well, we're not saying that. The authors of this article are.
Okay.
And ethicists. We are on the other side of it in the articles, pushing back to say, first of all, there really isn't a return to asylums because there never really were asylums as were ever considered way back in the day. Most of these places that you've just really well described were warehouses where people were left to be isolated from their family, their friends, their communities, and pretty much forgotten.
All right, here's the argument, though, and I am more with the authors of this, as bad as that is, and I'm glad we clarified. My apologies. I see people, no matter the best efforts, because of the cost, because of when there's localization of this, Michael, I've seen people that are not so good at managing and caring for these people. I mean, I had a situation in Mount Airy. Here's a real situation. We're playing a game, and it's a tie game, kids 10 to 12, and these guys storm onto the field. Apparently, my team lost, and one of them liked our team, and these two guys, big guys, come running onto the field and get into a fracas right there where we have to defend ourselves, etc. I've seen this, and, you know, it was just the idea that I've even seen guys running around the field, no supervision, etc., you know, people that are aggressive in downtown Philadelphia. There's not the supervision, the money, to be able to pull all this together in a smaller unit manner.
Right. So, I mean, Dom, obviously I don't know who the gentlemen were who you're talking about, whether or not they had any kind of significant behavioral challenge. We know that, unfortunately, in the urban environment we all live with violence. I think what's important for us to know is the facts are that people who have a serious mental health diagnosis are more likely to be the victims of violence than perpetrate violence, and that study after study has demonstrated that. And I also want to say that I'm not condoning or believe that prisons or nursing homes are places where people with mental health diagnosis ought to live either. I think we can do better than that. Our society can do better than that, and that there are many alternatives between jails and asylums that we ought to be thinking about before we jump to the conclusion that an asylum is a place that needs to be rebuilt.
All right, let's talk about how the big picture for listeners, Michael, I think that Obamacare plays into this in some way, shape, or form. When I see Ezekiel Emanuel, the big guy that I've interviewed a few times, as the co-author here, it tells me this is bean counting and cost cutting that's involved somehow or another with this.
So, I mean, I think that, as was well stated in the article, the costs to reinstitutionalize people are going to be somewhere in the neighborhood of well over $60 million annually. That comes out to about almost $190,000 per person. The average cost that we pay for people for community services in the country is about $4,000 a year. That's a big, big gap. If we were to take that $187,000 and move that into different and other kinds of community services, ones that we know that are working, I think there would be money far better spent.
Why do we not do that? What is the push? What's the other side? What's the agenda in your view versus where you're coming from?
Well, I mean, I think we constantly have to fight for these community services dollars, Dom. Every year, the budget that comes from Harrisburg, and especially over the past number of years, has continued to chip away at those dollars. I think some of it is because, I'll be quite honest, we are not as eloquent about the positive effects, and I think we have wonderful outcomes of the work that our community service organizations do. I think the other thing is that these are very vulnerable dollars. Hospitals are very powerful lobbying units. And I think also, I want to say that I think the authors I'm hoping, are being provocative about the idea that the notion that we should return to asylums to get a conversation going, sort of like we're having right now, about what the alternatives might be. There's been many, many services that have been developed over the past number of years, all of which, when they started, people didn't think would work. So, for example, there's a Housing First program that is operated here in Philadelphia. It started in New York. The idea is walk up to somebody who is struggling on the streets and offer them housing first to see if we can engage them after they're housed. That program has been enormously successful.
Well, wait a minute, though, Michael. What about those who say, not in my backyard, though? That's fine. We want to be helpful to people, but we don't want them living next door because of the obvious disruption and potential problems.
Right. So these are not group homes. These are not congregate care settings. These are people living in their own apartments where services come into them in their apartments and in a very assertive way. So case managers, social workers, nurses, psychiatrists come to their apartment to provide services to them. And again, Dom, the vast majority of people turn out to be wonderful neighbors, demonstrate that they can benefit from these services. But the idea is if we give people a safe, affordable, decent place to live first and then bring services in afterwards, it works.
All righty, Michael, I thank you very, very much. And we'll see if we can get you back on with Ezekiel Emanuel. We've been trying to reach him. No, I mean, I've had him on a couple times. I just think this is big stuff. There's a lot going on here. When he's involved, and this Go to Asylums headline is out there, there's big money, big agenda that's behind all this.
I'm sure there is, and I admire Ezekiel's work, and I think he's absolutely brilliant. I'm just hoping that, similar to his article about why I hope to die at 75, he's being provocative.
All righty. Thank you, Michael. I don't know that he is. A couple more interviews with me. And thanks, Michael. Thanks very much. 855-839-1210. You can get in.